A beloved doctor in Hudsonville is currently in the hospital fighting COVID-19.
And now one of his colleagues is reminding people just how life-threatening this virus can be. Our Lauren Edwards shares their story.
What we want people to know is that, for us, it is hitting home. He's a doctor that's actually been in the front lines of COVID.
And now Dr. Channing Finkbeiner is battling COVID-19 himself. His colleague at Mercy Health, Dr. Andrew Jameson, says that he's currently in ICU and is extremely sick.
He's a family doctor, but he volunteered to take care of people that were sick when he didn't know their status. He was going out of his way to put himself out there to take care of people, and he didn't get it at work.
Dr. Jameson says it's a reminder that COVID-19 is on the rise once again in our area.
Right now, we're at 15 to 20% of people test positive that come to us with a symptom right now. That's a huge number.
Especially considering it was only 2 or 3% a month ago, he says. The numbers are going up dramatically, he says, and fears this will affect capacity at hospitals, including Mercy Health.
The hospitalizations are going up. Those numbers that aren't just reflected in increasing testing, these are really sick people that are getting sicker.
And he says it's tough on healthcare workers, especially when taking care of one of their own.
And I can tell you that we've had, nurses that go home at night that have taken care of people like Dr. Finkbeiner, and they're just devastated.
So the best way to curb it, he says, is to practice social distancing as much as possible and determine the necessary risks to take.
If you have to be at work and you have to have your kid in childcare, that's a necessary risk. There's only so much you can do. You don't have to have a party for homecoming.
And believe doctors, because this is not a hoax.
It is hard when you hear people minimize this or don't take it seriously, because we're going to take care of their grandma tomorrow.
In Grand Rapids, Lauren Edwards, Fox 17 News.